welcome to Olsem Wanem. I'm Deborah Prentice. In this episode, we look closely at sex work and human rights. But first, Florence Jondowo gives us insight to the importance of eye care and the World Sight Day. This was celebrated on the 8th of October. It is obvious that many of us do not really take heed of the important roles our eyes play. Free eye tests are provided by various hospitals and eye care facilities. However, many people pay less attention in going for eye tests.
Our eyes are an important part of our body. Much of our non-verbal communication comes from the way we listen and express ourselves through our eyes. Our eyes can also reveal our moods, and to some degree, they reflect our health and well-being. Therefore, eye health care is vital and must not be taken for granted. Poor vision or blindness has a serious impact on the lives of individuals.
The theme for this year is actually vision for all, and especially children. Children who are low in vision, and those who are in need of rehabilitation. But eye care in the country actually has come a long way. In fact, from infancy, after independence, there was no eye doctor nationally trained, and in fact we were relying on expatriates until in the late 1980s. During that time, people were suffering in rural areas from eye diseases, not knowing that in fact there's things that can be able to be done for them, and especially talking about the blind people.
The theme is to eye care for all. So because there's less of us, less resources available, I think we should all get ownership of our own eye problem and get an eye check. If you have got a relative, or especially your parents, you know, if you know that you have a mother or father who's more than 55 years of age or 50 years of age, they need to have an eye check. Reading glasses, everybody will have to wear a reading glass by the time they turn 40 years of age. So, you know, you all need to go and have your eyes checked. Only when you check, then you will know whether you have that problem or not.
The sad fact is not much attention has been given by responsible, relevant authorities to address eye care in PNG. There are many factors that cause vision impairment for Papua New Guineans.
In fact, blindness from cataract and even low vision from people requiring spectacles is the two leading causes of blindness that in the country that we are able to tackle and treat. Cataract in itself, that amounts to almost 1% of the population. So if we have a population of 6-7 million in the country, we are talking about 70,000 people being blind out in the areas. And those are the populations that our National Prevention for Blindness is trying to advocate, so that we get support from everybody, so that we are able to go and give an extra hope of life to these people who are blind from cataract. Give them a second chance give them a second chance in life, especially in our culture in Papua New Guinea, where our young people, you know, they have to sacrifice their schooling, their education, in order to look after these blind people at home. And we hope by delivering this service, we can relieve these young people to come and try to get their education, so that they can actually pursue what they have in life.
My name is Jambi Garab. I'm the ophthalmologist at Port Moresby General Hospital. I am Deputy Chief and also the President of the National Prevention of Blindness Committee. Basically, the two most common causes of blindness in the country is still the same, because that's cataract and refractive error. So cataract is, the commonest cause is age. It's an aging problem, and our people are aging, and cataract happens earlier onset in Papua New Guineans. So by the time we see a lot of patients who are 55 to 60 years of age who are having cataracts, whereas in Australia they'd come at 70 years of age. So our cataract onset is earlier than our neighbors. Refractive error is the need to wear glasses only. So if your vision is not good because you just need simple glasses to see distance or near, They're the two most common causes of disease, and that's still, we see that a lot still. The other one that is now coming up is trauma. There's a lot of trauma with domestic violence, with tribal fights, and sports injuries, all these things that are still part of PNG. And I think we are the leading country in the Pacific with blindness due to trauma. We need to make people aware of the fact that they need to, look after their eyes more, and try to avoid. I don't know. We don't give an excuse for people domestic violence, but looking after your eyes is important. And also stick injuries. When it's mango season, you have kids throwing sticks and stones up to the mangoes, or kids play with bows and arrows or slingshots, and they can injure themselves. So trauma is another leading cause of blindness.
Another serious factor contributing to vision impairment and blindness in PNG is diabetes.
Diabetes and diabetes eye disease can cause blindness. If our message is that if you are diagnosed with diabetes, you need to have an eye check as soon as possible. Don't wait until your vision goes down, because then it will be difficult to treat. So we try to encourage the people at Port Moresby General Hospital get referred to the eye clinic, and they have a baseline examination, so that we tell them if there's something happening that they should come quickly for laser treatment or injections or things like that. Childhood diseases is a big problem. When we see children with red eyes, we don't get them to be seen quickly, or if there's a trauma and you don't refer them to the hospital quickly, or in remote areas, that will be difficult to bring them in. So childhood diseases will be a big burden on the country, because you have that person's lifetime is blind or is visually impaired as a child, and you need to provide for that person for his entire life.
You're watching Olsem Wanem. Although many people do not take eye care seriously, Chief Ophthalmologist of PNG, Dr. Melangas, is optimistic that eye care in the country will continue to improve. This is all because of great partnerships they have established with NGOs to address eye care in the country. Florence Jondua with more.
Eye care for people in rural PNG has improved over the years since the establishment of partnerships by the ophthalmologists with NGOs.
For ophthalmologist, lady ophthalmologist, Dr. Garap started networking to seek help outside, because couldn't get much help from the government, because eye was not a priority given our situations in the country. The priorities of the government were basically malaria, tuberculosis, now HIV and AIDS. And so we started doing networking to seek assistance from outside, from partners from NGOs. And that's when people outside our NGOs became interested, and because eye problem also is a worldwide problem, especially blindness, that we are able to prevent or even to treat. We were able to extend our services with their help to the rural people, in fact to some of the most rural places in the country. And we were able to deliver the services to those people. All people were able to see, they were able to see their grannies, their loved ones. And so, it's a story that we're proud of. And so today, as we stand to celebrate this day, we are proud to say that we've done quite a lot in terms of delivering the service, and we hope that we will have corporate interest from Papua New Guinea corporate sector, and also from the government. We still beg the government to come in and help us, especially as we strive forward to deliver this service.
However, the challenge still remains for PNG to have more eye specialists trained to cater for the whole population of this country. To date, we are still short on eye care specialists, and also we are yet to meet the World Health Organization's eye doctor to patient ratio.
As I speak today, we have about 14 ophthalmologists in the country, serving our population of almost 7.5 million. And so that gives us a ratio of about one ophthalmologist to almost 750,000 population.
We got 7.5 million people in the country. WHO says that we should have one per 100,000. So that means we need to have about 72 doctors. We've only got 14 doctors. We've lost some doctors to administrative roles, but we need to train more doctors.
Despite all this, we have promising times ahead with the training of eye nurses in the country.
We actually asked Fredolos New Zealand to drop a curriculum, and in fact now we have training for nurses, which is delivered at the University of Divinewood in Medan, and this is a one-year post-graduate program for nurses. And we are quite happy so far. We have graduated about 57 of them, and they are located in different parts of the country. And these are the people who are actually in the forefront of delivering eye care services to the country where we don't have enough eye doctors. And so they are the ones who see patients for us, who treat patients for us, and who screen patients that need a specialist review, which they can actually refer to places where we have established eye clinics in the country where the place is manned by an ophthalmologist.
The situation in PNG is that our resources, we don't have manpower and resources to go out to the rural areas. So most of the doctors that we have are hospital-based at the curative health services level. So it's hospital-based. Just in the last 10 years, we've been able to train allied mid-level eye care workers with the program that's run by the Fred Ollos Foundation New Zealand.
It's a success story for ophthalmology, coming from humble beginnings without any much help from our ministry and from the government. But we hope to continue to get the government to help us, especially in acquiring consumables, especially in the terms of spectacles and things that we need to do cataract surgeries, and also equipments in order for us to deliver this service across the nation.
Chief Ophthalmologist Melengas has this word of caution for all Papua New Guineans.
For preventative measures, we ask, because of the industries in the country, especially to take heed of industrial accidents, especially those involved in industries like chemicals, and especially to those swing population in the country to take heed also of Lyme, because it's one of the main causes of corneal blindness in the country, and so we try to prevent those conditions that we are able to prevent, and also a message to our people in the country. If we are able to train more people to reach them at their doorsteps in the country, I think we would do so, probably in the year 2020 and so.
Welcome back. We now take a closer look at sex work and human rights. Papua New Guinea's laws criminalize sex work. With that said, sex workers also face high levels of stigma and discrimination in society. And for many sex workers, the road to sex work is not an easy one. Many do this to feed themselves and their families. But the ugly truth is, trying to make ends meet can be deadly. Walking through the streets of Port Moresby alone at night can be a dangerous experience for women. But for some women, these streets have become an all too familiar sight. This is where they make money to survive. We interviewed 2 sex workers under the condition that they remain anonymous, considering the sensitivity of this issue.
Loside Blome, now I'm 40 years now. Loside Blome, Mr. go and talk clients, Mr. charge him on 3 to 200. But make a triple beginning. Na almost 2 or 3 years now, me come out na working this sex work.
For many sex workers, the road to sex work is not an easy one. Many do this to feed themselves and their families. But the ugly truth is, trying to make ends meet can be deadly.
Time me ask him customer lo condom. I'm thinking I'm giving more than that, so I'm like, you see me nothing. Na sample time me plus less or sample Mary also go through this like kind problem where or less or like you see condom na customer less now also paiti more or this like kind.
He'll say, how much do you want? I'll say 200. Then he'll say, in that case, I give you big money, I won't put condom.
Sometimes a policeman or by bungiol Mary lo road or by check your bag blow time on looking more condom.
And this is actually a very dangerous thing because condoms are an extremely important preventive measure for anyone who has multiple sexual partners. And many people do have multiple sexual partners. Let's face reality. And a condom is a very important thing to protect against HIV, to protect against all the other STIs, and to protect against unwanted pregnancies. And so to use condoms as evidence that you're a sex worker is, it's just unacceptable. It's not acceptable, and we've got to be very wary of that. And I'm probably speaking in my capacity as a member of the Global Commission on HIV and the Law. The Commission has actually finished its term, but we still remain in touch with each other, and our report has been published if people want to look on the internet for Global Commission on HIV and the Law. It's not a clear issue. That's the important thing. We need to think through all of the things involved. Think about why people might go into sex work. Sometimes by choice, but sometimes they see no alternative for their children, for themselves. A woman who's been deserted or widowed, and I know cases of both of them from my time, deserted, widowed, feel absolutely desperate. They cannot educate and feed their children.
Are you happy being a sex worker?
Sometimes. If I'm happy, I go out doing sex work.
Firstly, I want to say that I'm not advocating that we should promote those activities. I'm suggesting that it's a choice that people make. I hope, for example, sex work, for example, that it does not happen. It's sometimes it's dehumanizing for a person to engage in those activities. It's not an activity that people relish to do. But sometimes people might find themselves either in no choice, or secondly, maybe they prefer to engage in those activities. And again, I qualify that by saying that, I'm not suggesting that everybody is preferring to do that. But if people are engaging in that activity by choice or by choice or by circumstance, and we are condemning them, then we don't offer alternative, then we cannot be judgmental against them. So we got to create an environment by which they can either stop those activity, or secondly, that if they're engaging in those activity, that their rights and their dignity are maintained to the highest level as possible. And the law as it is now, like if you look at the law against sex work, it's mainly against women. You hardly see men being charged for engaging in what is defined in law as prostitution. It's mainly women who are charged for that offense, so it's also like a discriminatory type of law, either in itself or in the practice.
Over the years, there has been much debate on laws relating to sex work. In this segment, we speak to Dame Carol Kidu from the Global Commission on HIV and NCD Governor Powes Pakop regarding Papua New Guinea's existing laws on sex work and unnatural sex offenses.
The law as it is now, Deborah, as you know, it's criminalize that particular activity, both sex work and like if you homosexual activity between men and men and women. So that's the current criminal law as it is.
I think what I need to say first of all is that I'm talking about adults in private and with consent. Sexual behaviors of adults in private and with consent. I'm not talking about anything where there's non-consent, because once you get into that area, you're talking about rape or you're talking about some form of abuse. Well, at present, as you would know, prostitution or acquiring the services or selling the services is illegal in Papua New Guinea. And the Unnatural Offences Act from the 1800s British laws still exist in Papua New Guinea that deals with the transgendered gay community. I'm not ashamed to say that I believe these laws should be repealed, and that's just my opinion, and other people are entitled to their opinions. So the criminalising behaviours in private between consenting adults, I don't see much point in it. On the other hand, I want to make it clear that when I talked about decriminalising prostitution, I was not talking about legalising it. And there's a difference. I'm not talking about setting up a legal, brothel system and all that type of thing and monitoring. I don't support that either, because global research has shown that that is not a solution either. Because if you legalise prostitution and think, well, we'll manage it that way and we'll put all these rules in place, well, then what you find is that clients and the sex worker will protect the client very much, because they often, sometimes they build up quite a relationship, but it's not a marriage relationship. There was a strong feeling against it, and politically it's a very difficult thing to do, because if the public, when you rely on the public for votes, if you do some of these challenging things, it can sometimes jeopardize your position in terms of election. It didn't get out of cabinet. What came through cabinet was that, and I don't think this is not confidential, it was public, it was referred to the Law Reform Commission. I had a very, very, very bright young man coming to me from the Law Reform Commission, working on setting up the terms of reference to look into the issue more and to report back to cabinet, but it never got to that stage. It didn't get to that stage. I think perhaps the minister at the time really was quite against it also, because some people take what we'd call perhaps a Christian perspective on these things.
View in Parliament is normally, influenced by religion, and it's very passionate. So it's not easy to advocate the type of view that I'm advocating. I'm sure many of my colleagues will challenge me. There is a strong religious caucus in Parliament. You have seen recent development in terms of this King James version of the 400-year-old Bible and so on. Some of us try to keep that debate out of Parliament because Parliament should be a neutral body. It's a supreme body for everyone, whether you are a strong believer or not, you are from this religion or that religion, or the state should be here for all of us. And once we get our religious views come to Parliament, then it causes more division. So getting this type of views going to Parliament is not easy. But I think Papua New Guineans should start to develop a mature type of attitude to this activity and issues, so we can make a decision that is good for our people. I want Parliament to be a forum for everyone. Straight people, gay people, prostitute, whoever in the city. I represent everyone. I represent those so-called straight people. I represent all those so-called gay people. I represent the prostitute. When I went to the campaign in 2012, I had a meeting or dialogue with those sex workers to understand why they participate in this activity. I tried to look at ways by which we can get them to get out of this activity if it's not a choice. So my mandate also includes them. Other people in our part of the country might not have that mandate, or they might be in denial because those sector of the community might exist in their constituents too. But I can't deny in Port Moresby that there are people who prefer to engage in those type of activity, and those people are my constituency too. So I speak for them. I represent them. Yes.
And that's all for this episode. If you have any comments or stories you would like to share, please send us an email via the address showing on your screen or visit our Facebook page. Also, the Olsem Wanem show will now be aired on Thursdays at 7:30 p.m. as of next week. From the Olsem Wanem team, have a pleasant evening.